Hello, everybody. This is Tali, Berman, Autism Specialist, and I'm very excited to share that today we have 3 of our 4 members of the Whole Child team. So myself here, Roni, you want to take a minute and introduce yourself?
Sure, I'm Roni Antimpasokar, individualized biomedical nutritionist.
And Patsy, Patsy, you want to introduce yourself as well?
Sure. My name is Patsy Giarda. I'm a certified registered nurse practitioner specializing in primary care pediatrics.
Excellent. And Patsy works together with Dr. David Berger at the clinic in Tampa. And together, when we work with families, Patsy, your real point of involvement is really around the testing and the lab work that families need in order to understand and identify what kind of treatment needs to happen next.
Yes, absolutely.
Okay. So what we're really excited is to have the 3 of us here together and to really pick your brain, Patsy, and of course, Roni, see whatever you want to add along the way around certain topics that are sort of hot topics, things that you see really commonly, things that parents often have questions about, so we can learn a little bit more and become more educated about the kind of common underlying medical issues that sort of result in some of the symptoms and challenges we see with children with autism. And today's topic is Candida, which not just children, but many, many people, and I've definitely been a victim myself, have suffered from Candida in a variety of different ways. So I thought we could first start by just seeing, Patsy, if you could explain what is Candida and why does it become a problem for our kids?
Sure. So Candida is a yeast. It's a fungal it's a fungus that is typically residing in very small amounts through the GI tract. It can become a problem when it is overgrown, when there is too much in relation to healthy bacteria and healthy flora that we need in our GI tracts for overall nutritional health and immune health as well.
Okay, so an overgrowth of yeast, and this is something that I think a lot of many kids have this, and see if what either one of you want to add to this, but since it is so common among children on the autism spectrum, I'd love if you could just speak a little bit about why you think it is that so many children on the autism spectrum have an overgrowth of yeast.
I think there's several factors that come into play. Several children that are on the autism spectrum also suffer allergies. They suffer with ear infections. They suffer with infections that will oftentimes result in antibiotics. And oftentimes those antibiotics will strip the GI tract of the healthy flora, as well as getting rid of any negative bacteria that is in the body. So when that healthy flora is from their GI tract, it allows more room, more opportunity for that dysbiotic Candida to grow.
Mm-hmm. Okay. Roni, do you have anything you want to add to sort of what might be some of the causes that lead kids to have such an overgrowth of yeast?
Yeah, I just wanted to add, in addition to all the things that Patsy said, sometimes we just have picky eaters, food selective kids that for such a long time are focused on unhealthy foods that are stripped of their fiber and their nutrients and really rich in refined carbohydrates or sugar. So that can also propel forward what Patsy just said. If there's already a small Candida issue, it can definitely get worse, or it can be a contributing factor in and of itself. So totally agree.
Great, because I know there's some parents who sometimes will say, well, my kid hasn't had a lot of antibiotics, so I'm not sure if they would be a candidate for Candida and yeast, but definitely it doesn't have to be the sole reason why that could develop in their system. Mm-hmm. So before we get into sort of testing and treatment around Candida, I also want to share a little bit about what sort of symptoms might indicate that a child has Candida. If a parent is listening and thinking, I wonder if my kid is suffering from Candida, what kind of some of the red flags they can look for to know this might be something really worth investigating?
Sure, I'll take this one. So some behavioral things that we see that are red flags for kids on the spectrum that we would suspect Candida yeast are, so some aggressive, some kids have a lot of stimming, some kids are very sensitive to sensory overload, whether it be sounds or tactile, and they stim to soothe themselves. And some physical attributes that we see in some children are bloating. We see Either diarrhea, constipation, a combination of the two can occur. We will also see oftentimes, either a change in smell or appearance in the stool as well, a more fluffy type of almost mucus-like appearance to the stool that parents will describe to us.
Mm-hmm. So that covers quite a bit. I mean, this is the kind of thing that parents do with kids all the time, that their kid is stimming, that they're having sensory overload, that they're trying to compete in an environment that's very stimulating for them. Like you said, both either constipation or diarrhea.
I have seen both with children having Candida overgrowth. More often, I find that it's diarrhea, but I have seen a bit of a competing diarrhea and constipation. A child will experience the same even within the same week.
Interesting. And then you also mentioned the aggressive behaviors that could come along with that as well.
Yes.
Okay, great. And Roni, do you have anything that you want to add to that in terms of sort of red flags?
I was just going to emphasize the behaviors. Anytime there's just a wild behavior, something that's uncontrolled, aggressive, or unusual, I would want to explore and see if there's Candida present, an overgrowth present.
Correct me if I'm wrong, but one things I've heard from parents that I usually feel like have led to the detection of yeast is also what some parents will describe as kind of out of the blue or uncontrollable laughter. This sort of kind of drunken sort of state that their kid seems to be in. Would you say that sort of fits the criteria of possible Candida candidate?
Absolutely. I have seen the uncontrollable laughter out of nowhere with and that have come back positive for Candida.
Okay. So for any parents who are listening, these are just some things to look for. And if you see this with your child, this might be an indication that there might be Candida that's an underlying cause for some of those symptoms. So of course, if there's a suspect that's going on, I'd love to hear a little bit from you, Patsy, about what are some of the typical testing methods for Candida?
So we go on a kind of a twofold approach. We like to take a comprehensive stool analysis, which will actually culture the stool and let us know any bad flora or bad bacteria or yeast that will grow on the stool. And then we also like to look at an organic acid test. An organic acid urine test is a great way to look at metabolic markers for yeast.
Okay, and so you do both, and then if it shows up in one, then it's a pretty good indicator that there is a yeast issue, or do you have to have positive results in both in order to confirm that?
I like to see a positive result in both, but if I have a very overwhelming, convincing result on one and not the other, and the symptoms are there, I will treat.
Okay. And I think what's so important for parents to know out there is that this is exactly the process we support parents through, right? So if there is a concern that there might be a yeast issue, then we will definitely direct you. And that's what we think. That point of contact with you, Patsy, is what labs need to be done, how they need to be done, and then how they're really analyzed to see what the results are and what it could indicate whether Candida is present or not. Is there anything either one of you want to add before we get into the treatment around Candida?
I think Patsy covered very well the testing that's typically done. So
okay, so then let's talk about, let's say the testing is done and it's pretty clear that a child has an overgrowth of yeast. What is the common treatment used to treat it?
So there are two approaches that we'd like to take. So there's a natural approach that can be done through certain herbs. And there's a more pharmacological approach through prescription antifungals. And it really comes down to a discussion with the parents trying to figure out, okay, what are potential side effects? What are the benefits? And there should be an open conversation with the parents with what they feel most comfortable with Candida for their child. What's great about the comprehensive stool analysis as well is that there is a sensitivity panel on that. So it will allow us to find out exactly which natural and or pharmacological treatment would be best for the Candida identified for that child.
Okay, Great. And so, because, I think sometimes that people hear quite a bit about in terms of Candida and in terms of treatment, I know this for me came up too, is how diet plays a role in that, and can it be treated through diet at all? This might be something, Ronnie, that you want to field, and Patsy, I'm happy to hear if you have anything you want to add to that too. But can you speak to diet as a role to both prevent, which we'll talk about in just a minute, but also to even treat a yeast overgrowth?
Patsy, did you want to respond on that, or should I go
Sure.
ahead?
You can go ahead, Ronnie.
Okay. Yeah, I was just going to say, Patsy mentioned, the natural and the pharmaceutical options, and I think that diet definitely falls into a possible third option. Some people choose diet as the sole treatment for Candida. Sometimes that's effective, sometimes it's not. Sometimes you need the support of a natural treatment or a pharmaceutical treatment to go along with it. I definitely think in the long term, it's important to change diet in order to keep it away. So if the natural or the pharmaceutical approach does its thing, which it's supposed to, in that initial period of time, it's important to make sure it doesn't come back. Because Patsy, I know it, Candida tends to come back in kids that have suffered from it. It's important to, continue with the testing periodically, make sure it doesn't recur. And diet is a great way to make sure you achieve that balance, get the good bacteria there so that Candida reinfect or recolonize, and just keep the gut healthy in the long term. So really important piece.
Okay, great. And so what would you say in terms of the next piece? We have the diet component and the pharmaceutical and herbal piece that you mentioned, Patsy. So I just want to ask if there's anything else, Patsy, you want to add in terms of ways to prevent Candida either from coming back if a child's already been diagnosed with it, or if a parent is suspect that it might be something that's developing. What can be done to help prevent it?
Sure. So I think that the mainstay is always having a good broad spectrum multi-strain probiotic on board to help take up the space in the GI tract of good flora, the helpful flora that you want to see. And then also limiting sugars. Limiting simple carbohydrates should also be a mainstay in the diet of someone who is more susceptible. If you've been diagnosed once, like we said, it's more probable to reoccur. So we want to make sure we're limiting the simple sugars, the simple carbohydrates, because that's what yeast feeds on. That's how it reproduces. So limiting that will suppress the likelihood of it reoccurring. Okay.
Great. So what I'd like to do is as a way to sort of wrap up this, what you need to know about Candida episode, which I guess we can call it that, is just a little inspiration and information for parents about what are the kind of changes that you can expect to see for a child who had Candida, who then treated their Candida, and then just sort of on the other side, what are the kind of changes that you've seen with children who have successfully treated their Candida?
Personally, I've seen a reduction in a child's negative behaviors. That's something that parents oftentimes will sit across from me and say that that's one of their biggest struggles is aggressive behaviors, that they can't go public, that they're having difficulty in school, that they're getting calls throughout the day to come pick them up because they can't be around other children. So just normalcy of behaviors, and a decrease in aggression, a decrease in stimming, in addition to better, more regular bowel movements. Formed will often come into play as a result of successful treatment.
Great. Anything you want to add to that, Ronnie?
I was going to say, absolutely agree with Patsy, and an overall happier child a lot of the time.
Mm-hmm.
Better kid that just feels better. So, yeah.
And I think part of what's so important about this conversation, and thank you both for your contributions, is, sometimes if a child's having aggressive behaviors, they are being sort of worked with from a behavioral perspective, not that there's no place for that at all, but from that perspective to try to eliminate those behaviors or reduce those behaviors, which is just so much work for the parents, so much work for the staff, and oftentimes not all that successful when there's an underlying medical issue that isn't being treated. And knowing how important it is to sort of really investigate first and see, are there medical issues that can be treated? And if they are, great. And if not, then we know that we need to take this sort of from a behavioral perspective. I know, Roni, we had a family we worked with together, all three of us worked with together, who, she was Kira, who was pinching and screaming, and we saw that she was doing it at home, but not at school. And it was pretty clear that it was behavioral because she had already been treated for many other things. And so it's really important for both the parents, staff, and for the child to see if there's an underlying medical issue like Candida that's contributing to these behaviors, that it's treated at that level. So then it frees up everyone else's energy to work on the things that a child can really is available to grow in, because that issue has really been healed and been taken care of. And that's why you guys do what you do, and I'm so happy to be in a team with you, so that we're really taking things from all angles and a child really has a possibility to go to their potential, because so much of it can stem from underlying medical issues. So we'll wrap it up here. Thank you, Patsy. Thank you, Roni. And we will do our next video on methylation. So have a great day, everybody, and we will be back shortly. Bye.
Bye-bye.
Thank you.